So I think it's coming down. I think the immunocompromised people will be able to get their third shot pretty soon. I would say within a couple, 3 weeks, actually. I wouldn't be surprised if the full FDA approval doesn't come sometime between now and the first couple weeks of September, actually. By law, they have to give it a thumbs up or a thumbs down by mid-January because they have only so much time from when the application was put in. But it's going to come well before that. And no one anticipates a thumbs down for that. And it'll be a thumbs up. I mean, we have almost 400 million people who've gotten a shot of vaccine in the country now. Not 400 million people, 400 million shots. It's almost 200 million people. So we have a lot of data for the vaccines, and they're good. So what about vaccine mandates? A lot of that in the last couple weeks, including with our own health system, Wake Forest Baptist Health, as well as Atrium Health, as well as Novant, as well as Moses Cone, as well as Duke, and I could go on and on. Across the country, most of the major health systems have gone with vaccine mandates for their workers. So why do that? The primary reason is in the healthcare setting is to protect patients, because if somebody gets COVID, then they give it to a patient. That's a horrible thing. And it's been extremely rare up until now through the pandemic, because the PPE we use works, but we want it to be even rarer. And so that way when you walk into a hospital to get a hip replacement, you can be assured everyone around you's got vaccinated or has an exemption, which is a real reason that they can't get vaccinated. The other reason is to protect themselves, protect the healthcare worker, right? Because, I mean, you're taking care of COVID patients in the hospital, or you're getting exposed at home or out in the community. So in order to preserve our workforce, we do that. And then there's all the other good reasons to get vaccinated too, which we've talked about in the past. But those are the two biggies for the healthcare system. So we do that with a lot of other vaccines. Measles vaccines mandated, mumps mandated, rubella mandated, diphtheria, tetanus mandated, whooping cough mandated, chickenpox mandated, hepatitis B mandated, and did I say chickenpox? Mandated. So we've already been doing that. Flu is mandated in almost all hospitals now too. So it's out there. The COVID vaccines are not experimental. We have very good data. They're well outside of the experiment phase now. And people were worried about, oh, well, there'll be a long-term side effect at some point, 20 years from now. It's extremely unlikely. It's just as likely as you could get it from a new food you bought at the grocery store. I mean, you don't know the future.